So there's a viral video going around on social media in which a young lady is documenting her experience about getting a injectable aesthetic product called Juvelook in Korea, and then subsequently suffering a catastrophic complication in which she went blind in her left eye. And so I've been getting a lot of questions about it from my patients, and I think a lot of netizens may have a lot of questions about it too. So we're going to try to answer some questions. So first, what is Juvelook? Juvelook is a combination product. It's got two things in it. So the first is a dermal filler made of hyaluronic acid, and the second is PDLLA, which is a biostimulator. And the reason that the company behind Juvelook created this product is so that it addresses some of the issues of the biostimulator. So biostimulators are fantastic products. I use a lot of them in my own practice. The one I like to use is Sculptra. But the biggest complaint about biostimulators is that it takes forever to finally get your result. It can take months for you to get the result that you are seeking. But once you get the result, it can last for years and it looks incredibly natural. So the guys behind Juvelook were like, how can I get you some sort of result while waiting for the biostimulator to kick in? So they added in a dermal filler. Here's where the problem comes in. All dermal fillers have a risk of creating what we call a vascular occlusion. If you inject the dermal filler into a blood vessel, it can block off the blood vessel and cut off the bloodstream to whatever organ it's supplying, in this case, the young lady's eye. And so subsequently she went blind. Is it normal or common to go blind with Juvelook or other sorts of injectables? It's not a common complication, but it is very well documented. It's catastrophic, and every single provider who you get an injectable from should at least discuss this with you as they're consenting you for the procedure. So for that reason, I actually don't inject any sort of hyaluronic acid dermal fillers, because even though that risk is exceedingly rare, it's so catastrophic that that's just not something that I necessarily want to have weighing on me as I'm injecting the patient. So again, as this case shows, there's no such thing as zero risk, and especially when it comes to like cosmetic procedures. These risks that you're assuming, they're not exactly life-saving. So you really want to make sure that if you're doing cosmetic procedures, that you try to mitigate that risk, lower that risk as much as possible. So the way to do that, of course, to reiterate, do your research, talk to your provider, make sure you get a good vibe, don't rush into anything, make sure it's really what you want before proceeding with any procedure, injectable or otherwise.